Hi, it's Jo Macrone, Emet specialist here. I just wanted to pop on and do a quick video about a recent post to do with something that is super common, which is the Emet fear, nausea, anxiety cycle that just goes round and round and round. And I wanted to talk about the fact that we can try to firefight each individual element, but the way that the mind works, what we focus on, and the more sort of we try to focus on something, we tend to find that there's even more resistance. So in the therapy program that I offer, we go for the roots. We go for the root causes, right, to extinguish the flames at the top, rather than just trying to put a flame out each time. And so in terms of the body, it has all of these natural ways in which it actually wants to get our attention. And so to do with Emet, right, this is about a dysregulated nervous system that is really crying out for help. It is kind of saying, look, something's wrong. And of course, with anxiety, we know that one of the physical symptoms is nausea. But then, of course, to somebody that already has the association with sickness being fearful, every time they feel nausea, the fear response is kicking in, the avoidance, etc. So we're kind of going round and round in a loop. And so in terms of what I do, it is all focused on my program on finding out when did that nervous system for that person become dysregulated? What was it that they were trying to navigate? What was it to do with their environment? And this goes back to being very little to being very young, right? Emet sort of forms between sort of 4 to 8, but actually the roots can go much younger than that. So it's about, well, what was that person trying to navigate? What were they trying to stop? What were they trying to prevent happening again? What was it that they were confused about, didn't understand? And those things in childhood that manifest as a desire to understand, to change, to stop, become a desire to control as an adult. So we have facets like OCD, we have sort of food avoidance, obviously the environment where we go, what we do, and all of those kind of things manifesting attached to a desire for control. Whereas I'm always curious about, well, what was it that made control such a sort of prioritized importance for that individual? And by looking at the roots behind all of that, anything that's a surface level symptom is going to be changed and resolved as a consequence. So if you're looking for a program with your Emet that helps you go for the roots rather than firefighting, drop me a message and make an application. The link is in my bio and all of my social media, and I look forward to speaking with you.